Hi, welcome to this Science Saves video. My name is Sophie and I'm a third year physics student at the University of Birmingham, and I'm particularly interested in medical physics. The Science Saves programme exists to raise the profile of healthcare science and its associated careers. This video is being released as part of a series of interviews with a number of different healthcare science staff to find out more about what they do. In this video, we're asking the question, what is your normal role within the NHS?
I work in ophthalmic and vision sciences, so we use different techniques to look at a patient's eyes and visual pathway to help diagnose why they might not be seeing so well. So there's lots of different ways that we can do this. We use ERG, electroretinography, to see how the cells in the back layer of the eye, called the retina, are working. We can use VEP, the visual evoked potential, to see how those electrical signals generated by the retina are being sent along the optic nerve to the vision part of the brain called the visual cortex, where they're received and processed. We can also use cameras and lasers to take scans into the back of the eye to look at the structures of the different layers. I work in a paediatric department, so these objective techniques are especially useful because you can't ask a baby to read down a letter chart and tell you what they can see. You can also imagine it's probably not the easiest for young children to have to sit really still and focus for long periods of time for these tests. So we work together as a team to try and make the appointments as fun as possible. So lots of singing, toys, TV shows, anything to help keep the patient relaxed and interested and not sleepy.
Clinical engineers specializing in medical equipment management normally work in clinical engineering departments in hospitals, where they help choose which equipment should be replaced, and they work with healthcare staff, companies, medical companies representatives, and procurement managers on selection of the most appropriate device. Clinical engineers also arrange training on medical equipment for staff around the hospital. They write protocols and risk assessments around how to use and look after equipment. And they might investigate incidents where medical equipment was involved.
So I'm a medical physics undefined placement student, so I'm yet to choose my specialism. But the four that you can do within medical physics are imaging with non-ionizing, imaging with ionizing, radiation safety, and radiotherapy. So I'll speak for the rotation I'm currently in, which is my radiation safety and some imaging with ionizing things. So my job's really interesting. I get to go out on a lot of what we call surveys, which is when we go out and do the yearly testing on a range of medical equipment, such as X-rays, CTs, MRIs, ultrasounds. So it spans a range of different ionizing and non-ionizing modalities, and we do the testing to make sure that they're performing well and they're performing within our tolerances, and that nothing has significantly changed since the last set of testing. And it's really fantastic because you get to see this breadth of this huge breadth of different modalities within medical physics, and it gives you a chance to get some really good insight on how they work, and also so that you can see what kind of modalities you're best at and what kind of things you'd like to focus on in the future. So it really gives you that insight perhaps that you wouldn't have had before.
As a trainee embryologist, I work as part of a team to help people create their families. But as well as helping people have a baby, we can also provide support and help for people who would like to preserve their fertility. So, for example, some people aren't quite ready to start their family yet, and unfortunately others may be undergoing medical treatment that could make it difficult to have children naturally in the future.
So as I'm in my final year of the STP, I'm working towards my specialist training, which is echocardiography, aka ultrasound of the heart. And in that test, we look at the structure and the function of the different chambers and the valves within the heart. And this can be performed in an outpatient setting on routine patients who come in for a checkup for various reasons, whether they've got known disease or they're questioning whether or not they've got disease. Or this can be done in an inpatient setting with people who are a little bit more ill or critically ill. And then the other sort of main area that I focus on is the catheterization laboratories, the cath labs as we call them, where patients come in for assessment of their coronary arteries, and if required, they need treatment. So the physiologist or the scientist in this case is an essential part of the multidisciplinary team. And we assess the hemodynamics and the electrocardiogram of the patient, as well as keeping an eye on the vital signs of the patient, and then feeding that back to the team as required, as well as roles with equipment and that kind of thing. What's really exciting about that part of the job is that it can be done in the routine sort of elective setting where patients volunteer to come in with an arranged appointment, but also you are part of the heart attack emergency pathway. So on a day-to-day basis, you might have a day of quite normal, steady work, and you might have quite a few emergency cases.
But healthcare scientists sometimes in the NHS can be in the background. We're there in our offices and our labs, we're supporting people. We're quietly providing advice and reassurance to our colleagues in the clinical setting. But when something goes wrong, we're never too far away then. If an inspector turns up, a health and safety inspector, a CQC inspector, we're always there to help out with our expert knowledge.
In respiratory and sleep science, we're involved in performing lung function tests, respiratory muscle assessments, and other breathing tests, as well as analysing sleep studies and reporting our findings to the consultants. We're also involved in providing treatments such as CPAP therapy and non-invasive ventilation.
A massive thank you to all the healthcare staff who participated in this interview. Hearing about what exactly your roles entail has been really insightful. There are clearly so many different positions within healthcare science that we perhaps don't tend to get to see firsthand, so it's been really helpful to hear about the important work that's being done and how many opportunities there are for people who are interested in a career in healthcare, but perhaps not in the more typical roles such as doctors or nurses. If you enjoyed this video and would like to learn more about the role of scientists within healthcare, then please subscribe to the Science Saves YouTube channel, where you can find more videos like this. To keep up to date, you can also follow us on Twitter and Facebook at SciSaves. Thank you for watching.